All right, so electronic library catalogs. So making full use of available library resources is helpful, right? So all higher education institutions have a library catalog online. Some places don't even have their brick and mortar library, some do. It's obviously convenient for many students. Nursing professionals are not unused to working completely online. So the library professionals at the tiniest university, the busiest college, are available to demonstrate how to navigate your library catalog. And they will show you all the different things they have. So there's access to journals, books, databases. Some of your schools will give you access to databases that you normally have to pay a lot for or be affiliated with another facility, and other resources available to get into other college libraries. One thing I love is how they have ebooks. So quite often I don't even buy some of my books. Some I do, some I don't. And then the journal articles. That to me is always the prize because some journals are quite expensive to subscribe to. And then students in nursing programs at large university will find like free classes on how to navigate their online catalog. So like I said before, taking advantage of your online tutorials, your help pages, actually using the site, using the helpers there, the employees, it's just such a wonderful thing that's included in your tuition. And it's shameful, really, when people don't take advantage, especially if you're struggling in your research. So local public libraries often have subscriptions to popular databases. So, you won't have to pay for things for the most part. You're going to be able to get access to certain documents. And if there's an article that's like, oh, my college doesn't have it, oftentimes your librarian can request access for it. So there's never really an excuse in academia to say I didn't have access to knowledge, I didn't know how to research, and to not have high quality information because you have it at your fingertips now because of our technology. So let's stop a second. Oops, sorry. Think about what we've learned. So here's an example. You're doing research on how wearable technology is influencing healthcare, right? So like your MyFitnessPal or whatever. And you want to find appropriate resources in the school's online library, and you ask me for help for effective, efficient solution. What do you think I'd recommend? So do you think I would tell you to do a different topic, ask the librarian, purchase a subscription, or use a general search engine like Google to find resources? So hopefully you guys would say for me to ask a health library, right? Because regardless of the research topic, you still should be able to efficiently and effectively locate resources. And library professionals have the ability to help you search for things. Purchasing a subscription is not the first step you need to do. We usually have access to these databases. And then general search engines are helpful, kind of, but you can't trust everything. And when you're trying to research something scholarly, you really want to use a proper database. So informatics tools for collecting data. So real quick, I want to talk about fair use of information and sharing. Copyright laws in the world of technology are notoriously misunderstood. So the same copyright laws that cover physical books, artwork, apply in the digital world. Okay, so if you ever given a friend a flash drive that contains a computer game or something, you're obviously pirating or downloading a song without paying for it. And you have to remember that if you're copying pictures and then using it later. If you found a chart and copied the way someone did a chart, you need to ask for permission to do that. So it's really important that you pay attention to copyright infringement. So restrictions. Almost all software, music, and movies come with restrictions on making copies. Common restrictions and allowances include like a shrink wrap license, backup copies, transfers. So like software can't be transferred to a new user. And usage, there is usage guidelines. Bottom line, copyright laws are applied to the digital world, so you have to be careful. So for example, I created a survey for one of my research studies, and I just copied it from somewhere. I mean, this was early in my career, and my medical director is like, did you get permission to copy this? And I was like, oh, I didn't think about that. So I had to, ask. I think it was the Hitchcock School of Medicine at Dartmouth. And they were really nice about it. They're like, yep, absolutely. And you can say permission was granted, blah, blah, blah. So you have to make sure you also do that when you're writing papers, especially if you want to publish something. So anyway, informatics tools for collecting data and storage of information. So we as nurses, use patient care documentation, monitoring, interviewing data. We are so familiar with data collection, right? I mean, I could just talk to you about data collection until you're blue in the face. Formal nursing data sets are made up of gathered information such as healthcare definition, classification, nursing information. But before data can be analyzed or critically reviewed, it has to be collected and aggregated. And aggregated means for the numbers to make sense. So nurses generate and record data from their own observations or with the assistance of various devices. So there's free text, like informational data such as drug dosage, administration, resources used, problems diagnosed, and that's recorded electronically. But free text is then interpreted and organized by some standardizing principle, right? And we use this qualitative data to be organized and processed. So one central issue to the generation analysis of free text data is the lack of generally accepted set of terminology. So data becomes information when these separate components are interpreted and organized, combined, and structured with a consistent and specific context to convey it. So data managing systems. Okay, so data management systems consist of software designed to collect, sort, organize, store, retrieve, select, and aggregate data. And nursing and health data can be classified into 4 basic types. We have resource data, patient and client demographics, activity data, and health service provider data. And the primary data can either be recorded manually or collected electronically, with manual collection providing great opportunity for error. So when data is electronically recorded, the process has to follow a program set of instructions built into software. So it's not built in properly, you're not going to be able to find it properly. So, and when you have it built in, the search is going to cut down on error. So it's really important that the collection process is that the data collection form and the computer interface used for inputting the data is consistent and accurate. So qualitative data collection tools are like questionnaires, interviews, surveys, quizzes, assessment, and emails, and we have to be able to quantify those findings and transmit it. And it's harder to measure that way. Then we have to ensure privacy, right? So you have to protect the privacy of those that you're getting the transition or the information from. So examples of electronic data collection would be, during pilot studies, asking about lived experience. So quantitative data analysis is going to focus on numbers and frequencies rather than experience and meaning. And I want to just touch on this. Data analysis is the process of which data is collected during some sort of study and process, right? And then you look at trends and patterns to create a relationship. So you check the temperature of the water versus the scale of pain, and then you could extrapolate that the higher the temperature, the higher the pain, right? And that we use descriptive statistics to allow researchers to organize that information. There's a range of tools that are available to facilitate analysis, and that includes specialized data, word processing, or spreadsheets, and statistical packages like SPSS, which is probably the most commonly used one in academia. So sorry, back to quantitative data. Quantitative data focuses on numbers and frequencies with the goal of describing a situation and looking for more robust relationship. And these values are then entered into specific fields that have predetermined meaning. So they're a little easier to figure out, right? Because you're using numbers to quantify a finding. It's really straightforward. You can input it and analyze it quite quickly.